We are very excited at this meeting to present new data on Zinbryta. So mostly we have new data reinforcing its efficacy, especially over the long term, and also on new measurement of no evidence of disease activity, and also to reinforce the long-term safety profile of the drug over up to 4 years in the extension trial. So the focus is on the new measure of clinical and radiological activity called new evidence of disease activity. It's a composite measure looking at annualized relapse rate, disability progression, clinical radiological activity based on gadolinium enhancing lesion and new NT2 enlarging lesion. That's a very important component because currently it's one of the goals of therapy by some of the physicians. It's more and more used in routine clinical practice and clinical trial. So previously we've reported the data showing that Zinbryta had a better outcome on NIDA, this composite measurement, over an active comparator, interferon intramuscular, once a week. But the data was from baseline to 2 years. But what we know is at the beginning, this composite outcome might be influenced by pre-existing activities. What we looked at here is the effect of Zinbryta versus interferon during the first 6 months, and then during from 6 months up to 2 years. During the first 6 months, Zinbryta showed a positive effect versus interferon intramuscular, but the magnitude of the effect was much bigger during the next 18 months. So, for example, the no evidence of disease activity was achieved in almost 45% of patients in Zinbryta versus 22% with interferon. It really reinforced its efficacy profile because Zinbryta provides a high efficacy outcome for patients, which is very important. You know, there's a lot of therapies approved in MS, but there's no cure in MS. MS is a very heterogeneous disease, so we really need to find what's the most appropriate for each patient. So to provide this new level of disease activity for patients with Zinbryta, it's a great option for them with a new mechanism of action and also reversibility, which is very important. The overall goal of this work is to provide as much information as we can for physicians to really assess the benefit-risk of the drug. So, you know, MS is a chronic disease, so it's very heterogeneous. So patients will have disease activity on different drugs, so they need to think about sequencing, switching. So they need to know what to expect from each therapy and also to see if the effect is sustained over time. And for that, we've looked at another trial called the EXTEND trial, which is the extension trial. So in the pivotal trial, patients were randomized either to receive daclizumab or to receive interferon beta-1a intramuscularly. And after 2 to 3 years, they were in the open label extension. What we've seen in this analysis is patients who were on daclizumab all the way along remain with a very low annualized relapse rate and at the lower risk of disability progression compared to those patients who were initially randomized to interferon beta-1a and then who switched to daclizumab. When we are looking at new analysis, we are looking at two things. It's one on the efficacy side and the other one is on the safety side. So MS is a chronic disease, so you should expect that patient will be treated for many years. So it's very important to look at the sustained efficacy of the drug and also to make sure that we have a good understanding of the long-term safety profile of the drug. Yeah, that's true that we don't know what will happen 5, 10 to 20 years down the road, but for up to now the drug has just been launched and we are very confident with the profile of the drug in the sense that with the extension trial we have up to 1,500 patients who are in this extension, who are followed very closely, and in this interim analysis presented at ECTRIMS, we present data on patients up to 5 years. So that's very reassuring because it's very consistent to what we've seen in the pivotal trial. Zinbryta offers high efficacy with a manageable safety profile. So I think it's a very good option to be considered for patients who are not adequately controlled by their previous therapy.